So how effective is the Tdap vaccine? Really, does it give the strong protection for the both mom and baby? And are there any things that can affect how well it works that people should know about?
The goal of Tdap vaccine to the pregnant mother is to protect the newborn. So because the pregnant mothers, if they get pertussis, their infection is very mild. It will not hurt. It will not affect them very much. But the infants, yes, the newborn, yes. So the goal is that. So we have to look at data. We have to look at science. Because Tdap vaccine has been with us for more than 10 years. It started from 2012 in US. So now data has shown that it is highly effective in the first 3 months at least to protect the newborn from pertussis, from hospitalization, and from all this complication from Tdap, what Dr. Zul said just now. So it's highly effective. So it is also very safe.
All right, maybe Professor Datuk, Dr. Zulkifli, is it good to know that Tdap immunization can protect babies from the terrible disease? You also mentioned earlier the tetanus and diphtheria. What is the tetanus, Datuk? Maybe Datuk can explain more about this.
Yeah, tetanus is a condition that's caused by a bacteria that actually is found in the soil. It can be found in rusty metal. It can be found anywhere, and you get it from a cut on your finger. In babies, they usually get it from when you cut the umbilical cord. Pusat. So it's especially dangerous because what it causes is fever with muscle spasms and stiffness of the body of the baby. So when you see in the past, when we used to treat cases of tetanus, you can see the babies are stiff and hard. When you hold the baby, we cannot bend forward. So it's because the muscles are all stiff.
Yeah.
And we have to keep the baby in a corner where it's dark, there's no light, there's no noise. Because once there is slight noise, or if the light is on, the baby goes into spasm. And that hurts the baby. And they can also cause breathing, the muscles of the chest to go into spasm and stop breathing. So that's the danger of tetanus. And that's why it's put as diphtheria, tetanus, and pertussis, all three in one injection.
All right, next to Professor Dr. Jamiyah, I remember getting a ATT shot when I was pregnant, Professor. And I guess a lot of moms out there might have already had during their pregnancy too. So what happened to that?
Oh, tetanus vaccine is very important, like what Dr. said just now. But Malaysia is one of the countries has eliminated tetanus. So one of the many countries on the WHO. But the tetanus is still relevant if you have a patient who has no history of tetanus vaccine or you do not know, especially the first pregnancy. That's why in Ministry of Health at the moment, if you are in the first pregnancy and they do not know the complete history of tetanus vaccination, they will give the tetanus vaccine first. It's not wrong to do that. It's okay. So it still can be given. Then subsequently, after 4 weeks later, they should be given the Tdap vaccine because Tdap vaccine has a pertussis. Tetanus vaccine is standalone. It only protects against tetanus. So first pregnancy, you get tetanus. Then after 4 weeks later, you can get your Tdap. So if they give the tetanus during quickening stage, during about 20 weeks or so, then they will get the Tdap in Ministry of Health at 28 weeks, after 28 to 32 weeks. So if you're in the subsequent pregnancy, then you can give Tdap alone because the Tdap has already incorporated tetanus inside it. So you do not need to give tetanus vaccine. However, tetanus vaccine is still relevant, so it still can be kept. But let's say the patient had only Tdap vaccine in the first pregnancy. Is it enough? Most of the time it's enough to cover because especially in Malaysia, most of our population has reached more than 5 tetanus vaccine from their newborn stage. So that means it's safe just to give Tdap vaccine. But if you're not sure, you can still give tetanus, then Tdap vaccine. But what happens you get 2 tetanus vaccine? Is it safe? Yeah, it's safe. Data shows that it is safe.
Okay, we go to the Professor Datuk Dr. Zulkifli Ismail. So early we talk about the tetanus, but I'm curious, Datuk, what about the diphtheria? And I have heard that bacterial infection that can affect the nose and throat that makes hard for baby to breathe. Can you explain a bit more about how serious for little ones actually about this?
Yeah. The diphtheria is actually a disease that's caused by bacteria, and what it does is it causes infects the airway and the throat and the lungs. And what happens is you get a membrane inside the airway, so it blocks the airway. So when you block the airway, the air cannot go in. So that is diphtheria. This is now, we don't see any more diphtheria in the country now. But we used to treat a lot of, not a lot, but we used to treat a lot in the 1950s and the 1960s. But towards the 1970s and 1980s, when we first started work, there were no cases, except for one that I treated in the early 1980s, and that was a child who was about 7 years old, who had difficulty breathing, and at that time we did not diagnose diphtheria because we never heard of it, because diphtheria was already gone. It's gone. We give vaccination, but this child came from a community that did not want to give vaccines. So because of that, this child and the whole community did not get the vaccine. So this child came in, but we did not manage to save the child. But because we made that diagnosis, then the Ministry of Health went to that community and gave everybody the vaccines. So that will be to protect it so that there's no more bacteria circulating.
Yeah. When we talk about vaccination, that's what's or not. I know that some moms out there might be a bit worried about the Tdap vaccination, especially about whether it's really safe for baby or themselves. Can Professor help us understand how safe it actually is and what research or evidence that this Tdap good for baby and also the mother?
I understand that's a very good question because mom is always concerned about anything they take, even though medications, even though Panadol, they're worried to take. But if they're sick, you have to treat yourself. If not, the baby will also not be protected. So yes, they're concerned about the safety of vaccine. And we have to rely on data, science data. The Tdap vaccine has been with us for more than 10 years, 2012. So the data is more than 50 countries, including Southeast Asia, Malaysia, Indonesia, Thailand, and so on. So the data shows that the vaccine is very safe and it's efficacious. But of course, you must remember, we said just now, the vaccine is given from up to 36 weeks in most countries. In Ministry of Health, 28 to 32 weeks. But you have to give the vaccine at least 2 weeks before the baby is born. If not, the baby will not be completely protected. So because it takes about 2 weeks for the mom to mount an antibody. So it has been shown to be very safe. And of course, we will not recommend anything to give to our pregnant mother or anyone for that matter, even looking at medication, for example. We must ensure that it is safe. So we rely on science, of course. So we have to look at data all around the world before we can recommend. And now we are quite sure data shows that it is effective if it is given at least 2 weeks before the mom goes into labor, and it is safe. So if they get the vaccine today and tomorrow they goes into labor, of course, you will not be protected. Then that's where Dr. Zun's suggestion just not protect everybody. Everybody must take the vaccine to protect. It's cocooning, we call it. But then it's not enough to protect everyone, and it become very expensive. So this track record now shows that it is safe.
Or my last question to that Professor, following up on that, Professor, some mothers might be concerned, could receiving the Tdap vaccine during the pregnancy have any impact on their own health or the baby well-being? Are there any side effects they should be aware of if, let's say, the baby and also the mother take the Tdap?
Very good question. Because CDC look at all vaccine, not only Tdap vaccine, all vaccine given to all the population, and they track safety data. So if there are any concern, any reports, anyone can report. Even in Malaysia, they say you can report to the MPRA about any safety data. So far, the Tdap vaccine has more than 10 years. The majority of patients just have very minor side effects. It's just only local skin effect, pain or some redness. Rarely they get fever. So the major side effect is we do not see any complications toward the mother neither it has any problem to the mother. So in that respect, the vaccine is very safe.
Maybe there's some example is a Datuk lah who take the Tdaps before 11 years ago, right? So maybe the last word from Datuk to share to the audience about this vaccine Tdap is a good to everyone and safe to everybody. Maybe Datuk can share a bit to the audience.
Yeah. Tdap when given to the mother, it's just the antibodies from the mother that goes to the baby. So there's no harm to the baby. And it's been shown that it doesn't cause any problem to the pregnancy, it doesn't cause any problem to the mother, and the babies are born well.
Yeah.
So I think mothers should not be afraid of getting the Tdap vaccine. But if they have a problem, they cannot get the vaccine early or they have a problem with getting the vaccine, then the others around the baby should get the vaccine given before the baby is born or just after, so that you protect the baby from all around.
All right, thank you so much, Datuk. Maybe Professor, your last word to the audience.
I just want to stress the mother, they are the most important people to protect. Their pregnancy, the unborn fetus and the newborn. We're here to help them make that protection happen. So I hope mother feels safe with us. We can protect the newborn from pertussis and any other vaccine preventable diseases.
This conversation has been incredibly informative and eye-opening to all expectant mom out there. Remember that this vaccine can help protect your baby from pertussis. It is available at government clinic and is recommended between 28 weeks and 32 weeks of pregnancy. It is truly one of the most important steps you can take to protect your baby from the very moment they are born. A heartfelt thank you to our esteemed panelists, Professor Dr. Zulkifli Ismail and Professor Dr. Jamiyah Hassan for taking time to join me, Mas Romala, in discussing such important health topic today. Thank you so much for tuning in today. For more information, don't hesitate to talk to your doctor or can visit www.immunizeforlife.my. Bye, jumpa lagi.